Back to Connie now for an important segment that parents really need to see.
Yeah, Gwen, you and I both have glasses. Have you had yours for a long time?
Just once I hit 40, like 40, 41, my eyes really went downhill quickly. How about you?
Yeah, I think we both we both were right there together then. But a lot of kids have them when they're younger. Did you know that 80% of what a child learns during their early school years is visual? Trouble seeing can impact everything from grades to how much they focus in the classroom. So how do you know if your child needs glasses? Dr. Laura Perrin is an ophthalmologist with the New Jersey Society of Optometric Physicians, and she joins us this morning with a list of the signs. Good morning.
Good morning. Thanks for having me.
It's nice to have you here. You know, when we're talking about kids and schools, so much of what you see is, you know, everything in school is so visual. And if you can't tell that you can't see, you start to act up a little bit.
Right.
People don't realize that sometimes the way you behave in school is actually because of your vision.
Right. Up to 10 million American school children have vision problems that can interfere with their learning.
Wow, isn't that amazing?
And yes, as you mentioned, 80% of what kids pick up from the environment is visual. So you can see how important it is that their eyes are working properly so they can be successful students.
And 60% I saw of children identified as problem learners actually suffer from some type of undetected vision problem.
That's right. It's not a matter of just seeing the board at school. The visual system is very complex. The eyes, you know, children's eyes have to focus from the board to their paper, and that can happen over and over during the course of a day as they're taking notes, for instance. You know, children also need to be able to hold their focus while they're reading across the page. And also the eyes have to coordinate as a team, so it's not just a matter of what the right eye is doing or the left eye is doing, it's how they function together. And all these visual skills are necessary for a successful student.
And you're building those muscles up.
That's right, that's right. Unfortunately, a standard vision screening that you might have at a pediatrician's office or at the school nurse is not always sufficient to pick up these tasks, these skills.
And why is that?
Well, again, the visual system is very complicated. To me, a comprehensive eye examination by an eye doctor is the best way to pick up some of the subtle problems a child might be having.
Yeah, and when you're young, you might not even be able to read.
That's right.
So you don't know that, yes, I do know the words, but I can't see them.
That's right.
So what are some things that we need to know that as parents?
Parents and teachers need to be aware of subtle signs that children may show because they won't verbalize it. They don't know it's their vision that's causing the problem with their schoolwork. So you'll see things. A child will hold a book too close, perhaps, when they're reading. They may turn an eye and favor, you know, one side versus the other.
Oh, wow, sure.
You'll hear children skip words occasionally, or they'll even jump down to the next line. And they may even use their finger to help them keep their place.
Okay.
So any of these signs, you should really get them in for a full exam to pick up some of the more subtle issues.
Well, that's the question, too, because sometimes I think parents think, well, if my child can't read yet, then maybe I don't need to give them an eye exam. But actually, you can start very young with
That's not true. In fact, you do want to start early. The sooner you can fix a vision problem while the eyes are still developing and the visual centers of the brain are developing, the better.
Okay.
So ideally, a child should first be checked at 6 months of age. That's to make sure the visual system is developing normally since birth.
Okay.
After that, at age 3 is a good time to have them checked again so that we can maximize their preschool learning.
Okay.
Again, before they enter formal schooling, kindergarten is a great time to get them in. They can do all the tests an adult can do.
Okay.
And then every 2 years thereafter, unless their eye doctor recommends more frequent visits.
Okay. And it's all about being cool for some of the older kids.
That's
so show us what
we're talking about that
here.
Glasses are fortunately a happy thing for a lot of kids. They want to be like their friends. And these are, you know, glasses we have girls and boys versions. And on the bottom, I just wanted to point out, we have sports goggles that are really well designed and essential, particularly in the state of New Jersey. They're required for sports activities if a child does wear glasses.
Keep their peepers safe.
That's right.
Very
so
good.
Remember, good vision equals good grades in the classroom.
I like that motto. Dr. Laura Perrin, thanks for being with us.
Thanks for having me.
She's from the New Jersey Society of Optometric Physicians. Always nice to have her stop by.